staff?
Well, I'll pass to Susan.
Thank you. Look, you'd be aware we've made changes to the close contact arrangements for staff, but I must stress it is only under certain circumstances. That is not the rule across the board. The suggestion that people are being brought back to work when they're positive is certainly, we have no evidence of that. And if you are a close contact and you're a health staff member and there is a critical need for return, there is a process to be gone through. That's really important to understand. But like every other industry, health is impacted by furloughed staff. And we have more than 3,000 staff yesterday who are impacted by furloughing as a consequence of either being a case or a close contact, and we're working through that every day. The other point that I would make is that we've been preparing for workforce surge for 2 years. But Omicron has certainly impacted everything that we're doing, and to some extent over this period it created the perfect storm. Our health teams were looking forward to a well-deserved rest over Christmas. People are encouraged to take leave over this period. So, you know, it's been a really challenging period for the health system to get through this, and we will get through it. But the other really important point I think to make is that whilst we focus a lot on hospitalisations and ICU and ED and ambulance, which is all absolutely necessary, there's a lot of work going on in the community at the moment, and our health teams who are supporting the tens of thousands of cases in the community every day are going unrecognised. We have done our best, our absolute best, to get in front of this by providing information to people who are COVID positive to help them to care safely at home. We know that a lot of people can care safely for themselves at home because our numbers are demonstrating that each and every day. So there is a whole process going on in the background of this to contact people who may be higher risk, to assist them where needed, and we're doing our best to get to all of those people, working with general practice, etc. And all of that's being done to help also to protect our hospital system. So I think it's really important to acknowledge that none of our health system sits in splendid isolation. It's part of a big, connected, networked system, and that also extends to how we network our services, not just across the metropolitan areas, as we were doing yesterday. We had a very busy day yesterday. Let's make no mistake, it was incredibly busy, a lot of pressure on our ambulance service and our emergency departments, and we worked right through the evening to make sure that we were moving our resources around, and that's what we do. That should not be seen as a failure. That is seen as a system that is connected and working, and every single day of the week, 7 days a week, we meet with our chief executives, we talk about where our system pressures are, and as I said at the start, our health staff are our most precious resource.